We are back now talking about the explosion of COVID cases in my home state of Louisiana and the burden it is putting on the hospital system there. It is a warning of what could soon happen all across this country. That is a message from Louisiana's Governor John Bel Edwards. I spoke with him at the hospital where I was born, Baton Rouge General Hospital, Mid-City. A place hit so badly by this pandemic that they have put up a wall recognizing those who have contracted COVID and survived. Louisiana has the worst rate of new cases per day than any other state. Louisiana has the second highest rate of hospitalizations per capita after Florida. And it has the fifth worst vaccination rate in the country. Governor Edwards told me the situation is absolutely dire and he is urging people to get vaccinated immediately. Here's our conversation. This is all what? Patients?
That's right. That's right. That's the wall of heroes right there.
It's amazing. Thank you for doing this. At one point, this wall wasn't full.
No, that's correct. So this is not the first time we have used Baton Rouge General Mid-City as a special hospital for COVID patients.
Yeah.
And we've had to bring in outside staffing each time, sometimes from the Department of Defense. But we have 118 medical professionals that we brought in on a state contract to augment this hospital system so that they can take care of the patients here. 95 patients here, COVID. As you know, not a single ICU room available at this hospital today.
There may be even, I think there's 95 now, but you had 15 as of a month ago, and then all of a sudden you're at 200 at one point, or 100 and something at one point.
So we have 2,901 in the hospital today across the state with COVID. That is 10 times what we had on July 1st. 10 times.
Governor, I'm here. The hospital was overrun, overwhelmed with COVID patients. Louisiana has the second highest hospitalization rate in the country, second to Florida. You're not alone in this. All the states around you are just beaming red. You have a mask mandate,
sure,
but you're going to need the other governors and folks around you to cooperate. What do you need them to do to help?
Well, you know, I have more than I can say grace over here in Louisiana, and I don't really comment about what other states are doing. I will tell you we have a mask mandate in place because all of the medical professionals here in Louisiana told me it was absolutely essential to curb transmission to reduce the demand on the hospital, not just for COVID patients, but for all patients. You could be a stroke victim, you could be a motor vehicle accident victim, and you need hospital attention, you need a bed, you need a recovery room and an ICU and so forth. So it's incredibly important. The mask mandate to curb transmission while we get more people vaccinated. You know, it's not one or the other, it's both.
Everyone likes to be number one, but not in this.
No.
You're number one in case rates in the country.
Yeah.
What do you say to that? That's got to frighten you.
It scares me, and I know that the sad part is there's nothing in the data thus far to suggest we're at a peak and we're coming down on the other side of the surge. And we know that we don't have the capacity to continue to grow our hospitalizations. You know, we announced today 54 deaths today. That is just heartbreaking because we know that this is happening. The Delta variant is a game changer. But quite frankly, we had enough time to get many more people vaccinated in advance of this variant becoming a problem, and we didn't take advantage of that time to the degree that we should have, and that's why we're having this really nasty surge. This is the worst it's been throughout the entire pandemic, and that breaks my heart because this was not necessary.
I just interviewed a patient upstairs who said that she said I didn't pray for myself. I prayed for the people around me, and I prayed for the workers in the hospital. She said she had never heard death before. She's heard death since she's been here, and she knows because the staff will go from laughing and whatever, trying to help people out, and then silence because they've lost someone, and they're exhausted. She said they're miracle workers.
Well, they're doing tremendous work under very difficult circumstance, and the least that the rest of us can do is try to lighten that demand on them, that burden on them, by doing something like wearing a mask, making sure you're vaccinated just as soon as you can be vaccinated. And that really is the way out of the pandemic. We have safe and effective vaccines. They are free. They are available at over 1,400 locations in Louisiana, Don. Today, you can get vaccinated at more than 1,400 locations.
I got off the airplane. You can get vaccinated in the airport in New Orleans. Amazing.
Yes, sir.
There are people taking advantage of that?
There are. And the good news is, over the last month, vaccinations are up over 400%.
Yeah.
And so that's very helpful. We still got a long way to go, but that is very helpful. But if you start your vaccination today, especially if you've got a 2-shot regimen, you're 5 or 6 weeks before you're fully vaccinated, right?
Yeah.
So we're encouraging people, don't wait. Get vaccinated today.
A couple of people I spoke to said they had some concerns about the vaccine, not enough to not make them get it, but they just wanted to wait to see what happened, right? I experienced, and I just only interviewed a few patients, more ambivalence than anti-vaccination. Does that?
Yeah, but hopefully when people see what's happening now with this surge, and they understand how many vaccines have been administered, how safe and effective they are, they're going to stop waiting. They're going to get vaccinated. And we really want to reach some of the people who may have concluded previously they weren't going to get vaccinated ever, because they can change their mind too.
That was the thing. I said, I'm on TV every night. There are people on television every day telling, you know, in the papers, on the radio saying, get vaccinated, get vaccinated. They said, well, I just didn't have enough information. I don't know. How do you convince people that it is okay?
Well, and part of it isn't just that they don't have enough information. Many people are consuming really bad information, misinformation.
I was reading a story from the local WBRZ, Channel 2 television station, and it said that the patients who are coming in now are younger than before and whiter. That was their headline. Talk to me about that.
And not just younger. I was talking to some doctors. You're gonna speak to them in just a minute. You know, they believe they're sicker. You know, the disease is actually more severe now in the people they're seeing, and they're getting worse faster. And so it makes sense that people are going to be younger, because the highest percentage of people who are vaccinated are those who are 65 and older. So we're well above 85% of those who've had at least one shot.
Well, I think, but if you quite honestly, if you look at the map, the South is on fire.
Oh,
and
yeah.
I know that you said you don't want to comment on others or whatever, but you are in the South, and proximity can, you know, proximity.
This is a public health emergency.
Yes, it plays an important role in this.
And what every individual does or doesn't do doesn't just have an effect on them. It has an effect on everybody, which is the big, I think, disconnect between so many people in our country right now, is that they want to prioritize their individual right to do or not to do something. But you cannot manage a public health emergency in that regard. So you have to have certain restrictions when they are reasonably necessary to protect public health and preserve hospital capacity and so forth, which gets back to the mask mandate, for example.
Are you hopeful?
Oh, I'm very hopeful. You know,
Are you optimistic?
The mask mandate has been in place for a week and a day. Typically, it takes about 10 days before you start seeing the results from that. So yes, I am optimistic, because we've done this before. Now, not with the Delta variant, which is much more transmissible, potentially more virulent, but we've done this before, and I know if we can just get enough Louisianans to embrace, you don't have to have 100%. I'd love to have 100%. You don't have to have 100%, but if we can get enough Louisianans to embrace these mitigation measures, I do believe we're going to peak soon, and I'm certainly praying for that.
Thank you, Governor.
Thank you, Don. God bless you.
And thanks to the governor, and good luck down there. We'll continue to follow. But